Now we have Dr. Mu'min Diraneyya. Dr. Mu'min Diraneyya, are you with us? He is a Jordanian physician. He is a general surgeon, and he has the FRCS from UK, from Edinburgh University. And he had been working in many places and had experience in general surgery in many hospitals in Saudi Arabia and Jordan and so on. And he will also give us a talk about a successful experience or a story about Syrian experience. And I think this will add up to what Professor Mayram have gave us or expose us to in the previous lecture. Welcome, Dr. Mu'min. I'm so enlightened because I have a great respect for Jordanian physicians, as my first mentor in medicine was Jordanian too. You are very welcome, and you can share your lecture, please.
Bismillah. My talk about the Syrian experience in medical work under siege. No resource. I dear friend and very good surgeon, Dr. Hussam Hamdan, who was one of the surgeons of besieged Ghouta during the 8 years siege of Damascus Ghouta. Practice. Actually, I did not have the honor of working under siege. I worked as a surgeon for short periods in Aleppo, in North Syria, during bombing by the regime and Iran and Russia. Bombing that does not differ much in its brutality from what we see today in Gaza. Allah yansur Gaza. That work, although hard, but we had reasonable resources made available by the Medical Council of Aleppo and the Syrian organizations, including our organization, SEMA. So the description of low resources medicine doesn't apply to that work. My talk is in 2 parts. The first and more important one, I presented on behalf of my friend Dr. Hussam Hamdan, talking about the medical practice in Ghouta during the 8 hard years of siege. He's currently a surgeon at Shifa Hospital in Afrin, in Aleppo area. Also, I have some contributions from other members of the team of Ghouta, Dr. Abu Bakr, who made the project of manufacturing IV fluid bags, and the engineer Abu Yusuf, who was responsible for manufacturing surgical sutures. In fact, the Ghouta experience in working under siege was a great experience, and it made a distinct and unforgettable experience that made an important chapter in human medical history. This is the map of Ghouta, who was under siege for 4 years, closed completely, sieged completely, to starve to death. It's one of the most beautiful and fertile places in the world, and very rich in water and green. It turned into a war zone during these years. It was inhabited by about 500,000 people at those days. Most of the public hospitals were completely destroyed. The hospitals were targeted by the Syrian regime the same way Gaza hospitals are targeted these days. So the work was running in basements of regular buildings until our great Ghouta medical team could establish a big hospital of 80 beds capacity, completely underground. And because it is targeted always, it was connected to a tunnel, to tunnels and underground to secure access of patients to it. It also similar to Gaza tunnels these days. This picture is from a cholera outbreak in Ghouta in the days of siege. These are pictures that remind us also of Gaza scenes, the same scenes, the same type of criminals work here and there. The part of Dr. Hussam, he is talking about the work in Ghouta. In the first stage, they started to collect everything they can find in the area, from medical resources to logistic resources, and using anything, expired or not expired. Then, with shortage, developing shortage in all resources, they started to have strict regulation of the use of the available things, using anything that is very necessary and very indicated. This is the stage of rationalization of use of all resources, medical and non-medical. There was severe shortage of IV fluids. So they started using salty syrups to post-cesarean section as yogurt to save the saline for injured cases. In the second stage, they came to complete loss of most of the resources. Everything is out of stock now, and they started to look for alternatives. The gauze was no more available. They replaced it with white cloth, and they used to re-sterilize all things that can be re-sterilized, LP needles, whatever. Of course, it will be blunt and the use will be difficult, but they had to manage. These small articles, anyway, they could smuggle, because the small things was easier to pass to sieged Ghouta, and they started to manufacture different things, including sutures, but this happened in the last days of the siege, and they didn't. So they ran out of stock. All cylinders were used, and no more oxygen. They had the hospital there, but it was damaged and they couldn't repair it. And also they made some attempts to compress oxygen and fill the cylinder, but also failed. Then they didn't know how to operate the anesthesia machine and the ventilators, so they replaced the oxygen outlet with an air outlet. Shortage of medical staff was another problem. A lot of accidents, a lot of operations, very few skilled students, and they decided to qualify them. Each surgeon took 2 medical students with him, trained them very well, and because of the large volume of injuries in different specialties, general surgery, orthopedics, and vascular, they became qualified surgeons performing operations with them. This was a big relief to the medical staff there. They also had the idea of telemedicine. They started seeking in the area. They contacted surgeons outside Syria on Skype, and they operated in front of them while the specialist gave them instructions what to do step by step. They could do a case of esophageal atresia of a newborn under the instructions of a pediatric surgeon abroad, and it was done under the light of a mobile phone because there was no electricity at that day. They performed also some cardiac surgery after a shrapnel injury under supervision of a communicating cardiac surgeon. This is a recording of the operation. Okay. Logistic resources were a problem. Also, fuel to run the hospitals, to run the electricity generators. They started to collect all plastic materials and melt them to extract in fuel in a primitive ways. Manual water pumps to extract water. The most difficult and hard job was the sorting. In milder cases, that can be saved, that can survive, especially when there were children. And also amputation decisions for people who can be saved under normal circumstances. For example, in one occasion, the vascular surgeon had a femoral arterial injury, and he needed an arterial graft. He couldn't find it, of course. He bridged the two parts of the artery with an IV fluid giving set tube, but of course it failed and he had to amputate the limb, unfortunately. At the end, Dr. Hussam comments with nice words. He said, being a doctor in the siege with these large massacres and large number of accidents, he should try to take benefit from every piece of air and every drop of water. He finds and with shortage of resources, he should have two brains, one to think about managing the shortages and the other to think about methods to work with these alternatives. And he should have more than one heart, one his own heart for his family and another to take the decisions, the difficult decisions of sorting the patients. This is the experience of the 8-year siege of Dr. Hussam working in the Ghouta. Other contributors, Dr. Abu Bakr, fluid bag, creative engineer Abu Yusuf Nauman, who could manufacture surgical suture. Dr. Abu Bakr, for manufacturing IV fluids, it was a big project. It took a lot of time, a lot of efforts. This started working in General Medical Council of Ghouta with a group of specialists. One of them was pharmaceutical factory, and they could also contact a pharmacist who was specialist in laboratories, who was running a IV fluids factory before. They contacted him outside Syria, and he gave a lot of help. They began research, factories. They found a water desalination station and a distillation machine, but it was a small. They needed a larger one. They could find it in another factory. In the area, there was a lot of factories, and they could find this distillation machine with a capacity of 500 liters, and it was in a factory which was not working because it was located on the front line, on the border with the regime. They contacted its owner and took the device to their factory. Now we have a full line. This the salt they needed, they could find in a warehouse, raw material warehouse. They found 20 bags of 20 kilograms each of sterile injectable salt, and then found for this plastic, for the plastic, and found a factory for manufacturing plastic containers. This was the last challenge in this project. They began researching and experimenting the manufacturing these packages, which continued in a daily work for a full year until they were able to complete the process successfully. They made 1 liter plastic containers consisting of 3 parts: the main container, the rubber cap through which we outer cap to cover, and then they inflated with clean air using compressor. They added many filters to the compressor to purify the air as much as possible, and these packages then placed in airtight bags and went for final sterilization. A huge gas sterilizing room that was malfunctioning, but fortunately, alhamdulillah, their maintenance team, the engineer, they could fix this sterilizer, and they started using it. Then the containers were taken to bottling plant to fill with water and salt. They remove all impurities from the water, distilling it and adding salt with careful calibration in oil technique, then sterilized again with autoclave for any possible contamination. Finally, the examination and calibration was carried out by the medical surgical team of Dr. Hussam and Dr. Khalil. The salt concentration was standard, and the bacteria culture was negative. The first batch of 500 liters was released and sent to the emergency center at a time the Ghouta was completely out of stock of these IV fluids. And in that day, another massacre happened, so it came in the right time. After this success, liters, and after that, 20,000 liters were produced and distributed to all the hospital in Ghouta. This is the first production of IV fluids. This video was kept by the second batch of IV fluid bottles. The used IV fluid containers was then used to transfuse blood because of the shortage of blood bags. But they have to be enough for to prevent coagulation and clotting of the blood, and at the same time not to be over heparinized to cause bleeding. It was adjusted by the cardiologist, and they made a protocol to use these bottles only for 2 units. And if the injured patient needed more, then they would use regular blood bags later. They didn't document these things, picture it much, because they wanted to keep it unknown to the Syrian regime, because the regime was betting on the fall of Ghouta, on the fall of hospitals. Ghouta hospitals and medical personnel supported Ghouta during the years with their patience and creative work. Later, a UN envoy the IV fluids bottles production was in the liberated areas. The other part by Abu Yusuf Nu'man, who manufactured the surgical sutures, but unfortunately it was in the last days of siege. He is a very creative engineer. He established with his friends of educated people found in the area, established the Syrian Scientific Society, and they tried to be creative and think about all solutions they are facing. They started a project for malnutrition in children. They applied the American school recipes to make special dishes, of which they made and distributed large quantities to children. Their last project was the peanut butter. They made a special day of siege when they started displacement from Ghouta. The other, these are this is the project of children's dishes. The surgical sutures, he started by a careful research of how to do it. Then he started to this. They prepared fresh sheep intestine. After thorough cleaning, they soaked in sodium hydroxide and then cut into made by one of the team members, and then they dried these slices and spun into yarn to become threads ready for suturing. The result was great and successful, but this was in the last days of siege. When they received the machine, it was on the day of their displacement from Ghouta, so unfortunately it was not used. The other part of my talk is about a case of appendicectomy, very unusual appendicectomy, not low resources, but no resources appendicectomy. It's a painful one, really painful story. And all these stories are painful, really. The reference of this is a book of memoirs of one of the prisoners of the bad reputation, notorious Palmyra prison, Tadmor. It's located on the land of the ancient city in East. Mustafa Khalil is the author of this book, Al-Qawqa', the shell. He described in his book a surgical operation performed in the prison with almost no resources, not low resources. Appendicectomy, the everyday operation we are doing, was done in an unusual circumstances. It was exceptional by all means. I don't think there was anything like this in the medical history.
Dr. Mu'min, excuse me.
This is the book.
Sometimes the voice is not clear. Your voice is interrupted sometimes. So if there is anyone around you using the internet, would you ask them to turn it off, please? And you have 5 minutes, inshallah.
I will be closer to the mic.
Yes.
I will be closer to the mic, inshallah.
Please, yeah. And there is 5 minutes.
Is it okay now?
Yes, it's okay. It's okay. Okay. And you have 5 minutes more, please. Okay.
This is
Thank
Palmyra.
you very much.
Okay. This is Palmyra prison. The last picture is after they abandoned it, they left it. Many souls killed in this miserable place. One of the patients in the prison had acute appendicitis. The doctor with him, there was many doctors, prisoners in the same cell. They diagnosed them to have acute appendicitis, and one of them, two of them, called the prison doctor to see him, to refer him to the hospital for operation. When he came, the doctor, he was angry because they called him for such unworthy thing, and they punished the two that reported and called the doctor. Then a surgeon in the ward offered to do the operation if the patient agreed. He agreed, of course, to have possible death rather than definite death. And they started to look for instruments, to prepare instruments for operation. They had some objects well hidden in these prisons, in these rooms over the years. They made needles from pieces of bone. They sharpened on the rough concrete wall of the cell and filed it patiently for a whole day or 2 days or more until it become a sharp needle. Then they carefully drilled a hole in this small needle with the head of a nail, also sharpened on the same wall. And they made threads from old pieces of cloth and prepare it for tailoring. They use these things to patch their worn out clothes. They have been wearing these same clothes for years, but now we will use it for surgery rather than repairing the clothes. The scalpel was the challenge. They could manage the needles and the threads, but the scalpel was the challenge because no metal things are allowed usually inside these cells. They obtained this scalpel from a wristwatch back cover, which owned by the prisoner, the author of the book, Mustafa Khalifa. The surgeon used this as a scalpel after he sharpened it at the managed by boiling these instruments in a sardine can over a fire they made from collecting fat over the months from the frozen fat on the surface of food. They collect in a plastic bag, and they made a wick in the middle of it to form the wick to ignite the fat with a match box they hide somewhere in their cell. Then, after preparations, the patient was put on a rug next to the bathroom or door, because this is the only spot cell that is not exposed to the guard standing at the top of the building. The surgeon washed the patient's abdomen and his hands very well in soap and water of cutting made without anesthesia. 4 of them grabbed the patient 4 limbs and held them firmly while the surgeon started cut. He started incision in the abdomen. The patient cried, "Oh, mother." And the surgeon continued opening the abdomen without muscle relaxant, extracted the appendix, tied and sutured, and put some antibiotic powder from antibiotic capsule in the wound, and then sutured the wound and finished the operation. And the patient was carried by his friends to his bed. And they cared for him until he fully recovered a month later, but unfortunately he was hanged a year later. This these things who think that the Syrian revolution was unnecessary. والله غالب على أمره ولكن أكثر الناس لا يعلمون. Thank you very much.
Thank you, Dr. Mu'min, for this lecture. I think the importance of this lecture is showing the people how to use primitive resources to help others to do the medical and surgical procedures. And I think whatever the development, the civilization, whatever the progress in the science and in manufacturing and anything, we should keep reminding ourselves with that, because we have no guarantee that when we are put in this situation and when we need to use this. Thank you very much. Thank you very much. It's very informative. And I think Professor Muhammad Yusuf, he has a lot of comments.
No, just one or two comments because we are running out of time. The first one, really great thanks to you, my dear brother, Dr. Mu'min. And really, it's my respect and admire to all people, all health heroes that worked and has done a great job at that time. The second point, you are highlighting the great wisdom. If you have a will, you will have a way. But before and after, Allah Azza wa Jal is supporting all of these people. And really, when you have such great will to live, you will find many ways and many out of box approach. Thank you so much, my dear brother, Dr. Mu'min. I'm sorry for interrupting. Thank you so much.
Please, Dr. Mu'min, there is one of the attendees asking for the name of the book you have mentioned. So if you can put it on the chat, please, we will be so appreciating.